What is an RVU? RVUs is a point score system that payers use to price a CPT code. It's built from work, practice expense, and malpractice costs. This is what they use. They use these parameters to create this scoring system, the relative value unit system. But there is a hidden math to it. If you are getting paid, let's say from an insurance, a flat fee per code, the price that they pay you came likely from an RVU value times a specific conversion factor that the insurance company has put together times a value for the geography. In other words, you may perform exactly the same service to exactly the same patient, but because your location, your zip code of your practice is different than the zip code of a different practice, there will be a geographical difference for providing the service in one zip code versus a different zip code. Typical physical therapy treatment, CPTs, have modest RVUs. However, diagnostic testing CPTs, such as electromyography, nerve conduction studies, ultrasound, they are generally valued with higher RVUs because of the higher technical skill they include, the time, the equipment, and the risk. And all those make up higher values, higher RVUs, leading to significantly higher reimbursements for the utilization of those diagnostic testing codes. Sometimes those codes are valued 3 to 10 times more than the codes for a physical therapy procedure. Is the system then, that's the real question, valuing your services as much as your patients do, and how you can speak the system's language to get paid like it? Patients value, right? Patients feel less pain with what you provide them. They regain function. They are able to work faster. They return back to sports. They can enjoy the time with their family because of your services. You provided them freedom from pain and freedom to move and freedom to function. That is a huge perceived value. So that is how the patients value your service. Now, how about the system? How the system values your service? Well, they don't look at that. What they look is the payment on specific code values. So there are MPPR edits, there is the authorization of the services, documentation that you have to write, and increasingly outcomes-based valuation, access in various areas for different providers, and experience. There is a mismatch there. You can deliver life-changing care for your patients, but you face flat per unit rates. That's why blending RVUs with value metrics does matter. And that's how diagnostics can change the math. Really, they can bring the value back to where it belongs, to you. How is the RVU scoring and the financial dollar pipeline? RVU score is based on dollars through a conversion factor and those geographical adjusters that I just spoke about earlier. So why some codes pay more? Well, they have more complex work. They require higher practice expense and risk. And therefore, that increases the total value of that RVU. On the other hand, although certain services require much less work, much less effort, their RVU value tends to be much higher compared to other CPT codes that they require a lot more work, a lot more effort, and yet their RVU value is lower. That's the unfortunate thing.